Laparoscopic gastric bypass is a kind of bariatric operation similar to sleeve gastrectomy, but it's different in some ways. We make the operation minimally invasively with laparoscopy or robotic assisted with a small incision again. In the operation, we make a small gastric pouch from your proximal stomach and make a connection between that small pouch and small bowel. So we make a restriction and malabsorption in this operation. And because of this malabsorption, usually we see some hormonal changes and insulin sensitivity is improve well. So patient give their kilos and their metabolic disease resolve in this operation. The indication for laparoscopic gastric bypass are body mass index over 40 or body mass index over 35 plus additional comorbid disease related to obesity. We choose these procedures in patients with serious insulin resistance or type 2 diabetes, or for patients with metabolic disorders, metabolic syndrome, and in patients with non-alcoholic fatty liver disease. We prepare patients for gastric bypass by doing a patient visit. They come to us and we make some health screening tests and make some consultations. We perform abdominal ultrasonography and upper gastrointestinal endoscopy and choose the patients for obesity surgery, especially gastric bypass. The day before surgery, they need to avoid drinking or smoking, and they need to be hungry and thirsty before the surgery. Recovery period of surgery after gastric bypass surgery is easy because we make the operation minimally invasively by robotic surgery or laparoscopic surgery. The day of surgery, when the patient is awake, we mobilize them. And after mobilization, usually they have no pain anymore, and they stay that day in the hospital. We check their vital signs. The day after surgery, we make some tests for leakage or bleeding. If everything is normal, we start liquid diet, and our dietitians visit the patient and teach them about their diets. And they stay in the hospital at that day. The other day, we usually speak to them again and send the patient to the hotel. They need to stay in Turkey 3 days more. We call them for a last control, check them, and if everything is normal, we can send them to their country. They usually need to stay in Turkey about 7 or 10 days, but the full recovery takes about 1 month, and they can go to their country.